Your media, where you are.
Welcome to The Calling. Thank you yet again for joining us today. Yes, it is myself, Mkulunka Nyamba. Of course, most of you know me as Neo, all right? And today we've got a very interesting episode, if I have to say so myself. A lot of times we ask ourselves, is there a place or a point where Western medical practice crosses paths with African indigenous healing practices? And so I decided to invite Dr. Koketso. Yes, she's a medical doctor, but ke motho wa moya and ke motho o tsamayang le bagolo. She's spiritual like that. So I think over and above a lot of things, I'm jealous of her. So, Koketso, doctor,
Yes, no.
thank you for coming through today. Really appreciate having you here. And we hope you can, get a better get the knowledge bombs.
It's my absolute pleasure to come and share the space with you.
Yeah.
And I'll only be sharing my own personal opinions
Of course.
what I know from the medical field and the journey that I've been on.
All right. And let's get into it. So when did your journey start as Moto, somebody that is Moto Abaholo, somebody that walks with the elders, and somebody that is spiritually inclined? And, as a healer, I mean, of course, the work of becoming a healer never stops, right?
Yeah.
It's a lifelong journey.
Yeah.
You're still learning until you die, right?
Yeah.
But when did your journey start? Just so that we can give our audiences some background.
Sure. I think for me, that's a difficult question.
Yeah.
Because I have come to be able to retrospect and think, Hore, when did I actually start being spiritually inclined? My
Yeah.
journey has been rather a long one. I mean, I grew up in a Christian family, but I always knew that my grandmother was spiritually inclined to a certain extent. We went to different churches where there was a mixture of your usual doctrines that were being merged with African spirituality. So you would be told that you are a prophet, you are gifted, but at that point, I don't think I was ready to accept, or I don't think I understood what it meant, because it depends what kind of space that you are in, where people will either shape you into what they are comfortable with and only impart the knowledge that they only know or are comfortable with.
Yes.
So somehow everybody has always told me that I'm spiritually inclined, or I have a gift, or I have a calling, but it always came in different forms, either in church or in forms of dreams or what other people call intuition. But I think I started being more self-aware in the last year now, where it's being named differently.
Yeah.
Previously, Nelor or Muporofeta.
Yes.
Or you have intuition, but I think it's just been the same thing throughout. So it's rather been a long journey. I think it was from a young age. I think in high school. In high school, I mean, it's taken different shapes and forms.
Of course.
Until the stage. So, yeah.
So now, alas, here you are, medical doctor, right?
Yeah, I am.
And and I find it so interesting, right? How would you say this side of your healing work as an African indigenous practitioner, right? Is merging or coming together with now the Western medical profession that you also have this side, which is your primary, work every day, or, at least most of your days you are spending at hospital with patients and so forth. How's that merger coming along? What does it look like for you?
I mean, from a lot of readings and a lot of practices from both Hippocrates, your Greeks, and the people who are writing books on herbal medicines are the same experts of Western medicine. So I think Western medicine in itself has evolved, and it has been modified it has been modified and it has now been regulated. So for me, the same herbal medications that were being studied in the old BCs, your Greek mythologies and Western culture back in the days, I think
Yes.
it's the same medicines that we as Africans are using. They're coming from the same soil. They're just mixed and refined differently at this point, and they're just governed by different regulations. For me, where the merger comes from, I mean, we meet people from different walks of life.
Yes.
Some are spiritually inclined. You meet atheists, people from different religious backgrounds. Either people believe in prayer or they will come and seek Western medicine, but merging it with their own indigenous practices, being it whether you're African, you're a Hindu, people are always coming to seek help from Western medicine, but they're also using their own indigenous practices. And I think my first encounter having to acknowledge the two and where they could potentially interconnect. You get a patient at the hospital who comes, most African people, especially in your townships or villages, before they come to Western medicine, they've either been seeking help from traditional healers, and by the time they come to the hospital, they have either deteriorated or there are some complications or they have ingested medication the way it was not supposed to. So it's always a thing that there's herbal medication intoxication, and how do I reverse that with Western medicine? But I think the danger in that can be averted when you merge the two, because...
How do you merge it though? How do you supposedly go about merging it?
So I think the problem comes when people when a certain practice is being shunned upon.
Yeah.
People are either misinformed.
Yes.
And the way they use medication or practices is not the way that they're supposed to. Because if you come to me, let's say I'm a medical doctor, but I'm spiritually inclined.
Yes.
And you feel more comfortable to either try Western medicine or start with African medicine. I mean, there are healers that are now studying your Western medication and African medications, and they are able to understand how the two interact. So if the one practice was not being shunned upon and people were more open about it, people will be more educated and empowered. And I think we'd be more liberal about talking about it and empowering people and imparting knowledge on people and being able to give people the option of using either or using both. So I think it's just a matter of that people are more inclined to using Western medication or Western practices because that's what's being marketed and that's what's being socially accepted.
Okay.
I mean, our forefathers, my grandmother's always used herbal medication and herbal practices for healings and stuff.
Yeah.
And she's never fell sick. She's never went to a hospital with
mother's never been to hospital?
with
the side effects.
With the side effects or had adverse effects from whatever medicines that she was using. We grew up, I mean, if I had a flu, my grandmother would boil lingana, and that's
very
what
popular.
was used during COVID.
Yeah.
But like it was already, I knew lingana before COVID happened.
It didn't come up as a result of COVID being there.
No, it didn't.
Yeah.
So, but because now, previously before COVID, it was looked upon as muti. It was not being talked about. It was shunned. And but all of a sudden now COVID happened, lingana became popular. So had we talked about lingana before COVID, because it wouldn't have been taboo to talk about lingana then. But because now Western culture and Western medicine then popularized it during COVID, then it became more accepted socially. So, I mean, there are a lot of African practices that have been adopted into Western medicine, but there's no acknowledgement as to where the merge is and where the cross-linkage is. That's why lingana all of a sudden, it's just one of a few things. Yes, it's just one of the few things. I think there is an interlink. It's just a matter of people being empowered and people being able to own their cultures and not being shy of where they came from in their upbringings and understanding themselves.
Okay. Now, here's something that's going through my mind, right? And then there you are. You also doing healing work, from an African perspective, right? Janaka Moto, who would be referred to as a prophet or as a ngaka and so forth. And I would imagine however way that happens, but at some point you'd probably administer something in the form of herbs. You understand? Provided you are shown, however way your gift works, right? And somebody comes there to your practice and so forth, and they need assistance. Uh, you know, I'm imagining a situation, and maybe I'm just being a bit naughty,
Yeah.
and I'm thinking even my audience is here big,
Yeah.
probably thinking the same thing. How do you manage a situation where, like, you are at work, Western medical profession, you are in a hospital, and you're dealing with a client or with a patient,
Yeah.
right? And you do your diagnostics checks, and you see, all right, fine, this is what I'm supposed to administer, and so forth. But then, for lack of a better word, then you get that edge.
Yeah.
Your people are like, hey, we are also in the mix.
Yeah.
How do you then make a difference? How do you then say, okay, fine, I trust my people,
Yeah.
but also I took this Hippocratic oath, and these are the rules and regulations that govern that, and this that my people want me to use as a solution or as a healing measure has not gone through the tests that would then qualify this under the Western medical fraternity. You understand?
Yeah.
So how do you balance that? How do you make a decision? Do you just say, "Hi, Nina Tulan, like just keep quiet. I'm not going to listen to you right now. I'm at a hospital, and like this is my Western medical hat that I'm wearing right now."
Yeah. I mean, I'd like to be that there's a time and place for everything, and I'd like to believe that the opportunity to study for medicine was one of the ways from my guides to get through to me. It's one of the ways that they have blessed me to heal and work. So I'd like to believe that the work that I do in Western medicine within the hospital, they have orchestrated everything to come together and work together.
Yeah.
So I find myself very fortunate that when my guides do speak, they are humble guides and they do not impose themselves, and they will impart knowledge. And if ba voga or reba, they come into the picture.
I'm imagining there's a patient there.
Yeah.
Talk a sniff.
Yes. No. If they do, I think I'd like to believe they're smart.
Yeah.
Because every time it has happened, it's always been at the right place, at the right time, with the right audience, with the right patient, with the right person. So it's never been like a monkey show.
Yeah.
So every time they have come through, it's because I suppose it's always a matter of aura, energies, the recipient, and if the place is not right and they are coming through, I'll find a way to intercede for that person, be it with prayer or just during healing. You're just touching them while you're doing your work, and you know that either your guides or their guides are coming through.
But it's not something that you would verbalize to the client.
I won't impose it. I won't impose it on anyone.
All right.
I will not impose it on anyone, and I'm very fortunate that my guides have been respectful in that sense. That's why I'm saying that I have a strong feeling that they orchestrated my journey into medicine, and now them coming through at this point in my life. So I'm just fortunate in that sense. They always come through at the right time, at the right place.
Well, so far you've been lucky, right? There hasn't been an episode, all right? But now this is now the next part. Do you think that African indigenous medical knowledge or healing practices could find a way of collaborating with Western? I mean, you've sort of alluded to it when you mentioned Uguti, even the Western medical practices and some of the things that have come through an evolution of what used to be, which would have been indigenous knowledge, right?
Yes.
So do you think today we could see or we could reimagine an institution like where, you have a mix of all of that? And what would that look like? Just humor me there.
Well,
And maybe our audience is there,
Well, absolutely. In my imagination, what that would look like, I mean, we have doctors now and pharmacists
Yeah.
that are spiritually inclined who go on and extend their knowledge of either medicine or pharmaceutics and are able to study herbs scientifically in a lab, the same medication or the same herbs that they will be prescribing from either the pharmacy or Dindumba Tsabone.
Yeah.
And people are going on and studying that, either herbs or pharmaceutics. And it's just that some medications are either formed from the same root. It's just the refining processes and how they process the roots or the herbs, and then the regulations around those roots and herbs. So imagine someone who has an inclination towards pharmacy or someone with an inclination already towards medicine who's able to take a double course or a double major. Like, I'm interested in pharmacology, but also in African medicine or just herbs.
Yes.
And you merge the two. I mean, the same resources that are available to study Western medicine.
Yes.
And I don't believe there's anything as Western medicine. It's just the different refining process and the regulatory councils that are really different. So they are deemed to be safer when they go towards, when they are regulated and go through a stringent process just to study the pharmacokinetics or pharmacodynamics. This is how now a drug works on a body or how a herb interacts with a certain drug. So, I mean, I know of a doctor now who's a sangoma, and who's a healer, and he is studying pharmaceutics, herbs, and he's now doing talks about herbal medication and drugs and how they actually interact, how Western medicine in their refined form interacts with African herbs. Wow. So he knows the side effects of both African medicine, the roots, and the pharmaceutical, the medication that are made by pharmaceutical companies. And the other part I was saying is that the same way that someone can go to school and decide to study theology, for example, it's the same way that someone can have an interest in studying either spirituality, be it African spirituality, and you could merge the two, or it could be another form of study. I mean, there are people who have had an interest in how culture has developed and African descendants, your African genealogies. There are people who've written theses on them, PhDs on them. I suppose it depends which institution that you are in. So I think it's a possibility. It's just a matter of how it's accepted in society, and people being able to come together as humanity, being able to have respect for one another and each other's differences, really. It takes away nothing from someone. I mean, from my lineage that I've heard, apparently I have Irish descendants. What's wrong with an Irishman to find out that we are actually having some common connection within our genealogy? What would be so wrong in studying that and learning that? I mean, there's one other thing that's going on where people are doing DNA testing and connecting all over Africa. You get some white people that are connected to African descendants, white people from
African
wherever.
ancestors.
Yes, and people who are studying archaeology and the evolution of man, and they're finding out the differences in people's DNAs. And I think it's the same thing. When you are going through the spiritual journey and you're trying to find where your roots are from. It's the same thing that we get taught how to draw a genealogy or a family tree. It's the same thing that I was saying, that this is what you say you call umsamo. It's the same thing for me. So there are a lot of things. I mean, in psychiatry, as I was saying earlier, that people have different traits and different personalities of a certain psychiatric classification.
Yes.
But before you get to a dysfunction, you are a functional person within society, but you have certain traits of a certain what they'd call a psychiatric disorder. For you to fulfill that criteria, you first have to be dysfunctional in society. But let's say now I'm a spiritually inclined person and I have different traits from different classes, but I'm still functional. Let's say what I'm alluding to is, as a spiritually inclined person, you either hear things, you see things, or you smell things.
So under any other circumstance, right?
Then
if you were to walk in at work, and say Dr. Sloan or Dr.
Meredith.
Madope, listen, we cannot do that surgery with that particular patient or client because I'm seeing things. Right? You'd be classified delusional.
Yes.
Is that what you're alluding to?
Yes.
Right? But what happens in the case where you actually did see that? So, how do you deliver?
So I try to do what I can when I can.
Yeah.
And I'm only sent by my guides to do things that are within my own strength.
Yes.
Right? And I'm not going to change the world tomorrow. And some things, when you see them, doesn't mean that you are supposed to
do anything about it. You either pray, and you have to judge the situation. You don't want to go and either compromise yourself or compromise your patient. As your Hippocratic oath would say, first do no harm. Right? Yes.
So I'm not going to, it cannot be that I'm within a group of scientifically inclined people, and all I have to give for them is that my spirit says. They will not understand me. So you have to judge.
But you would actually use what you have been shown by the spirit.
Yes, but it has to make sense.
You'd use the scientific knowledge to actually interrogate what the spirit is telling you.
Yes.
And then should it come to the same conclusion, then you'd be able to then present it, but from a scientific perspective. Is that what you're saying?
Yes.
All right. So now that brings me to the next one, right?
Yeah.
Now, as a doctor, I mean, how many years do you study to like, you know, for one to be considered, you know, minimum years, for one to be considered, doctor, right? And you can have the title in front of your name, that prefix. 6 years, right? Minimum.
6 years.
All right. And then obviously you'd specialize and whatnot,
if
right?
You want
so that's
to.
A lot of years that you put in, right?
Yeah.
And then somebody goes out, goes epiphany, and guess what? 3 months to 12 months, they come out and we can refer to them as doctors. Do you think that's a fair thing? Like, I don't know. If you're a doctor right now, you're sitting at home and you've gone through the drills and the red tapes and you've put in the energy and you went to a Western medical institution and you did your 6 years or however many years. It's a lot of years. How do you feel, that somebody can go inclined by the spirit and so forth? Ayotwaza, like they go into an initiation school and they learn, healing practices. 3 months or 12 months, they come out and then they are also classified as a doctor. How does it make you feel? Like,
I think for me, I feel like it's a misnomer.
Yeah.
It's just doctor with the ships. Kidi, in our villages back in the days, those were the only doctors. It's a direct translation, yangak.
Yeah.
Yes. How you are going to ngaka. But now I feel like it's become a direct translation because ngaka in Western culture comes with certain accolades, certain recognition. The same way ngaka in your African culture comes. Those were the accolades. Those accolades. Those were the accolades that were acknowledged in the village before Western medicine came.
I mean, we have to remember.
Yes.
For a long time, we
didn't have Western medicine.
They were midwives, right?
Yes.
They never got practice hospital or at a medical institution, right? But there were mothers.
Yeah.
Whose speciality was to deliver babies.
So that's what I'm saying. It's a misnomer that now we have to compare the two. And ngaka has now gained a direct translation to doctor when doctor is a Western culture, Western medicine title that has its own specific recognitions and accolades that you must go through this medical school. Bongaka barona, it came from the guides who are the ones that prescribed as to how long must you be go pehlweni, how long must you do this to qualify to be able to do 1, 2, and 3. That was us.
So
I don't
you have no
think there's-
issues with somebody going 3 months and then they show them, the healing practices to South Africa, and then they come out and they have the same title as you?
But I think those people are referring to themselves as they want, because as I say, Dr. Lingaka,
Yeah.
they have different accolades. Just now, they're just making it now like a direct translation.
Yeah.
So 2 different things for me. If you're a doctor wa MBBCHB, you are different to ngadka oiling pehlweni.
Okay.
So there must be a distinction. The same way you'd say you have an MBBCH from UCT or MBBCH from WITS, you must say, if you want to address yourself ngaka or doctor, you must say your accolades are African traditional medicine, so that there's a distinction
So
between
there
the
needs
2.
to be a clear distinction. Like,
Yes.
you'd be a doctor, but it would be a doctor of what?
Yes.
All right. I'm just curious, how much time do we still have? And this is taking like a very interesting twist, and I'm sure even yourself there at home, you're wondering, can you ask questions and so forth? Look, you can always drop us an email, thecalling@yomedia.co.za. That's thecalling@yomedia.co.za. If you just joined, I am joined here. I'm with Dr. Koketso Pule, and then also I would say ngaka as well. All right, meaning that from an African perspective, or healing practices, as well as Western healing practices.
That's still overwhelming to hear. Yeah.
So now here's I think my final one before I let you go, right? Because we've been at this for some time. What would be your advice? Because you know what, some UCT white paper that I was reading, I just forgot for the life of me, but it cited that about 70% of Black South Africans actually rely heavily and use, traditional healers, as opposed to specifically Black South Africans,
Yes.
right, as opposed to Western medical. And we touched a little bit on this, but what would your advice be around, where should one start? Should one start with going to consult with a Western medical doctor, or should one go and start with a indigenous traditional healer? Where should we start? Like, how do we bring these things together and help them to work together?
So I can't specifically say where you start, because first of all, it depends what you are consulting for.
Yeah.
And at what point of your issue you are consulting for.
I would imagine that, in this regard, like I've got a pain, in my leg or wherever, just.
So I think when the paper talks about your 70% of African people being reliable on traditional healers, most of your South African people from the villages, sometimes
Yes.
that's all they have access to.
Ah.
Right? So I cannot dictate to a person where to start, but I think it's really for me about just safe practice. You can't be, for me, it depends where you are, what's available to you and what you are consulting for. If there is a life-threatening condition that needs a surgeon, a traditional healer is limited in that sense. A traditional healer is not going to operate on you
Yeah,
at
it's
that
not gonna
specific.
perform.
No. So if it's a life-threatening issue where you need a surgeon, you can't start at a traditional healer. Maybe let's first take care of this life-threatening event, then go back and then consult as to why this is happening and how you can avert it, right? Anything for me that is life-threatening needs a medical doctor,
Yes.
right? And if it's something that it's a slow progression and you believe in traditional medicine, it's just a small ailment, or your legs are sore, you have a small headache that's been bothering you for a while, or you feel like you feel a void in terms of your spirituality, or you're trying to connect with ancestors, that's not something that you'll consult a Western doctor for, right? A pregnant woman, like the baby's not coming, you are like having a high risk pregnancy, for me, you cannot start with Western medicine because now there are 2 lives at stake, right?
Okay. Yeah.
So it's always for me like a balance, risk as to, so I cannot dictate to someone who is fully rooted in African traditional medicine to dictate to them as to what to do, when, or how.
Yes.
But in terms of safe practices, I think also your traditional healers must also be able to triage out their patients.
Yes.
To say that if a certain patient comes to me, this is what's within my strength, this is what I can do, or say I recommend that you go to the hospital. Once this is done, then come back to me. So I think it could possibly be a collaboration. And even in the medical field, you always have to know your limitations. So I think also traditional healers as well should know their own limitations as well, and know when to intercede and to always practice what's in the best interest of their clients or patients. So it's a two-way street for me, and it's just a matter of balance and making sure that your client or your patients are always safe.
Wow, doctor, thank you so much. And I think, whoever you are sitting there at home right now, and maybe this has helped you balance a couple of things and so forth, and it's not to put down either side, but you are promoting finding a way of collaborating, if I'm not mistaken, Doc.
Absolutely.
Just before we sign out, any last words, any final advice from a medical doctor perspective, and from a perspective of somebody at motho wa moya?
Sure. I think for me, growing up the way I did, I think identity, knowing your self-worth and your roots and where you come from is always important. And always being rooted in your sense of self is always important, because life evolves and so many things happen. I like to think that as humanity, we need to be more kind towards one another and more accepting of one another. And I think there's always power in unity. And I think we would make such a big impact socially, globally, in medicine, African culture, Asian culture, Hinduism, Buddhism, if we all came together as humanity and just being loving and kind. I mean, other than that, I don't think I have much to say, but from a medical point of view, is that always be safe, and we shouldn't pass judgment on one another. But whether as ngaka or as a medical doctor, I think we should be working together in ensuring the safety of our clients, our patients, and the community. Because whether we like it or not, African culture is here to stay, and so is Western medicine. So, yeah.
Wow. Well, you heard from the good doctor, and that is Dr. Koketso Pule. She graced us with her presence today, and we really appreciate that. And I also appreciate you for joining us again today on The Calling with myself, Neo. All right. Till next time. Thank you.